ahead and record right now. All right. This is recording. Hello, everyone. This is Dr. Armin Tehrany. I have one of my wonderful patients who, his name is Milan. Milan, you, just before we got on this call, you said you agree for us to record this conversation about the conversations we had, what you're going to be going through, and how we can educate the public about risks and benefits of working in a surgery center for surgical procedures and a hospital.
Of course.
Good, good. Thank you. So when you injured your ACL, we decided that it was in your best interest to have surgery for it and reconstruct the ligament.
Mm-hmm.
Then the coronavirus became an issue, and we were concerned about the risks of doing it. Number one, because of the safety of the facility, and also afterwards, physical therapy and your ability to go. And you and I talked about this. I made sure to call you separately to discuss the risks and benefits. And to me, your case needs to be taken care of because you're more likely to get a negative outcome if we keep waiting or not do it. And two, our surgery center doesn't get any coronavirus patients like the hospital does. So it's safe to proceed. Plus, I've spoken to physical therapy CEOs, and they've assured me that their facilities are safe and there's enough social distancing between patients to ensure safety. So could you share in your own words with the public about the conversation we had and how we're going to go through?
Well, we said that you told me that everything's clean and safe, and I should have no problems going in.
Right.
I mean, first you asked me if I have any problems.
Right.
So you don't get infected from me.
Right.
And so far, I'm not sick. I don't have any symptoms. I'm very healthy. And you are as well, very healthy. And the facility has minimal staff.
Yes.
And it keeps nice and clean all the time.
Yeah.
So
Yeah.
shouldn't be any problems.
And it's important for the public to know, I can't promise zero chance because there's no testing yet. There's no testing yet to prove that. We do it based on symptoms, and we are looking forward to when testing is available that is highly accurate at proving that we're all immune. So far I am, so far you are, so far everyone else in our surgery center is. And we've had no cases of coronavirus so far, thank God. And we want to keep it that way.
Of course.
All right, great. Well, thanks for your candor. Really appreciate that. And I'll see you tomorrow.
Okay, see you. Thank you.
Take care. Thank you.